Most people are afraid of the word cancer. For those who have never been diagnosed or had a family member battle the illness, cancer sounds like an automatic death sentence, and it can be very serious with less than optimal outcomes. But patients should know that the diagnosis doesn't tell the whole story. Many patients do go on to survive for years, and all patients can find ways to increase their quality of life during their illness. While everyone discusses the physical aspect of the disease, the diagnosis is often the most emotionally stressful. That stress can't be discounted. It takes a toll on the patient's mental and physical health. A cancer survivor goes on a very emotional journey. It starts with the initial diagnosis. As soon as the patient is diagnosed, a treatment plan is enacted. After treatment has finished, there's a post-treatment period where the patient will often need some recovery time. Once they have completed the treatment and are in remission, checkups and visits will go from maintenance to scheduled checkups. These will grow less frequent the longer health is maintained. The truth is that many sufferers live beyond cancer. There are more than 10 million people in the US today who are cancer survivors currently. Some may be in the process of treatment, and others have been in remission for many years. Cancer survivors include anyone who has ever been diagnosed with cancer, their family, and their caretakers. While it can be difficult for the person diagnosed, it can also be devastating for their loved ones. While the cancer diagnosis can be exceptionally stressful, patients and families should remember that a positive attitude and measures to keep hope and spirit up can be very beneficial for everyone. There are treatment options available today to make the fight more comfortable and less uncertain. It's important for friends and family to be supportive of a loved one who is diagnosed. This might mean listening while they vent, or helping with chores that they don't have the energy to finish. It's also important to treat the patient the way they have always been treated. Many cancer patients don't want to be treated differently just because they're sick. For many patients, asking for help can be difficult. It's important that patients feel free to ask for support and to use every resource that makes them feel more comfortable. Many patients benefit from participating in their faith and working with charitable causes. Caregiving can also be very stressful, so it's important that the full-time caregivers use the resources available. This might include support groups or just the help from friends who will be there for them. Once the recovery process has started, patients find that returning to their routine can help them feel more like themselves. It's not uncommon for cancer survivors to want to spend more time with family and friends, or to want to do things they've been putting off. Once patients enter remission, they will need to follow up on care to guard against reoccurrence. The follow-up plan will be specific to the patient and often crafted based on their genetic history and the type of cancer treatment completed. During follow-ups, the doctor can check for signs of cancer as well as other late effects the patient may be more at risk for due to treatment.